Start out talking about women's heart disease. J. Paul, our director, if we can see our lovely two guests first. To my immediate right is Cathy Weaver, noted columnist for the Greensboro News Record, and herself a personal, I'm going to call it a survivor, or at least she has a personal story about heart disease. We'll get to that in a second. Next to Cathy is Cindy Schicker, who is a nurse and patient care coordinator at High Point Regional Health System, and we welcome both of you ladies to talk about this very serious topic. Cindy, let me start with you. What are the risk factors for heart disease for women?
Well, primarily hypertension, high blood pressure, high cholesterol, LDL and triglycerides, the lipid panels, you have to watch your cholesterol, smoking, overweight, being overweight, stress.
All those things that common sense should tell us we need to avoid. But now I'm also wondering, since we're talking about, obviously, the heart disease for women, let's stay away from the gender question for a second. My question then is, who is at risk in the subgroups, such as age of women, race? Is it more predominant among people of color? Is it more predominant among older women? How does that shake out?
Well, primarily, cardiovascular disease is the #1 killer of women aged 25 and older, and women at age 50, it increases significantly. As far as race, there is a significant increase, studies have shown, in African American women, Hispanic, and American Indians.
All right, now let's go to a personal story. Cathy, what problems did you have specifically, and what were your symptoms?
I was perfectly fine until one day in March 10 years ago, and I started having chest pains, nausea, shortness of breath, heavy sweating, numbness in my left arm.
That had to be scary.
It was very scary, and immediately I figured out I had to be having a heart attack or either a pulmonary embolism or a panic attack, because those are the three things that cause chest pain in women.
And you were how old at the time?
39.
Good gosh. And that doesn't surprise you, Cindy, that she fit a profile, or what? I mean, did it run in your family?
What I had, we're not sure, because what I had should have killed me instantly, and it did not, thanks to really good cardiology care, immediate care.
And you went and you got help quickly.
I got help quickly. They recognized the problem. I had a artery that was dissecting or rupturing, and I had 5 stents placed, and that resolved the issue right then.
How has your life changed since then?
I changed gears from full-time work to freelance and consulting work. I lowered stresses a lot.
That's a big part of it, isn't it?
It's a huge part of it, and I think that it's a big attitude in a life-changing event such as surviving something that should have been fatal. You really look at where your priorities are. I wanted to write more, and I not have the budgets to worry about at work and things like that. So I started working from home, was able to travel with my family more, and take better care of myself.
Cindy, what are some things that women can do to reduce the risk of heart disease?
Well, primarily they can control, there are certain risk factors that they can control, and the primary two that the studies suggest is to keep your lipid profile checked and your blood pressure checked. Those are the two biggest significant risk factors that lead to heart attacks, heart failure, and stroke.
Regular checkups all the way around. Now, you have a big event that I know that two of you want to promote that's coming up very shortly, and I think it's on February 2nd. What's that all about?
Go Red for Women. It's a national event going on in the United States now, and it is primarily, we want to get women aware that cardiovascular disease is the leading cause of death for women 25 years and older.
And I think we have something up on the screen about that. That's going to be at High Point Country Club, February 2nd. What is it, a luncheon primarily?
Luncheon. Cathy will be speaking. There'll be a fashion show put on by Talbots, and oh, I shouldn't say people.
No, that's all right. No, that's all right. You can say whoever you want to.
Oh, okay.
And by the way, Lori works here, but she is not in charge of the show. Lori's our floor director.
I'm sorry.
She bosses me around, but please don't ask her permission for what. All right, now, so we know that. Now, quick question before we leave. What advice do you have to women who say, well, I think I'm okay, I don't need to get any checkups?
You need to have your regular checkups, and you need to take control of your health and know what your blood pressure is, what your cholesterol levels are, and what your family history is, and then do something about it. You do have some control.
Well, I appreciate you all sharing that information. Will you all come back sometime and let's talk more about it?
Anytime.
Okay.